Pledge allegiance to the flag.
Pledge allegiance to the flag
of
of the United States of America. Indivisible, with liberty and
Thanks everyone for attending this. Thanks everyone for attending this. May 176 work session of the Umatilla County Board of Commissioners. I do want to remind everyone that this meeting is being recorded and also can be attended virtually. We do have time for public comment on anything that is not on the agenda. And we'll call for that comment here shortly, but it is a work session, so we'd like to keep that to 2 minutes today. Any additions to the agenda? No, John, Cindy? No. Okay. Let's move to the any public input on any items not on the agenda. Yes, come on up. Stand right here in front of the tables. Give us your name and address and the topic you'd like to speak to.
My name is Eddie James Antonello. I live at 1104 Southwest 37th Street here in Hamilton, Oregon.
Thank you.
And I had some designs I want to showcase at the meeting here. It was like a challenge point. So here's the back side, and then here's the front side here. Thank you so much. So for the 250th anniversary of the United States, they're based on that, but they're part of my campaign for Umatilla County.
Well, let's not get into campaign issues here at a public work session, but but thank you for submitting these. These are just ideas.
Yes, they're just ideas.
Perfect.
Thank you, sir.
That picture looks a lot like you, Eddie.
Yes.
Thank you for submitting.
Thank you. Thank you.
Thanks, Eddie.
Thank you.
Anyone else? Okay, let's get started with the business items. The number one is the Crisis Stabilization Center. Who wants to take the lead on that?
John can do that. I didn't know I was on here, but
Okay.
So looking at this, previously it's been discussed that detox and Pendleton renovated using rural health transformation funds into a crisis stabilization center. Previously used as a detox center. So the request actually be to discuss the options for the facility for a crisis stabilization center. We talked about this last meeting, didn't we?
We did. And then we asked to bring it back. I think Cindy asked to bring it back to the first session. Yeah.
And the reason that I asked to bring it back was because we need a detox center. And even though I think that the Crisis Stabilization Center is probably
What can I ask? What do you think a detox center needs that a crisis center can't provide?
they're two different things.
Yeah.
And you're getting into something, I'll be real honest, it's not my, I mean, I would really have to do some research on this, John.
So I've done a ton
Okay.
with Kimberly Lindsay.
Okay.
Basically, I said, okay, because I was on the same side of the coin. I thought we needed a detox center. She's like, well, why not a crisis stabilization center? So we've always had detox. And it kind of, it's one of those things, just because we've always done it this way doesn't mean it's right. Both facilities, you can take somebody who's under the influence of drugs and alcohol, drop them off. Both facilities are volunteer only. So if the detox, if somebody who's intoxicated got dropped off the detox, they said, I'm out of here. There's nothing you can do. They're out. They leave. Same thing with crisis stabilization center. If they want to leave, they can leave. The one thing a crisis stabilization center does that a detox center does not do, it also does behavioral or mental health as well as behavioral health. The detox center just does behavioral health, but it has to have a medical doctor 24/7, 365 on the scene. So in a crisis stabilization center, if they need a doctor, they just go to the hospital instead. So I mean, plus it's a whole lot easier to staff a crisis stabilization center instead of staffing a detox center with a medical doctor. We used to have one on call for a crisis stabilization center. So it makes way more sense. It's easier financially. It makes way more sense. It's easier to staff it 24/7, 365. And that's the model you're seeing with going with statewide is they're trying to get the crisis stabilization centers up and running. So
The crisis stabilization center is the personnel that work in the crisis stabilization center are peers.
not just peers, there's also LCSWs and QHPs. Well, QHP is a qualified mental health professional and LCSW is a licensed clinical social worker.
And those will be on staff also.
But you can also staff those with peers, or you can't staff it with peers at a detox center. And you have to have medical doctors or a nurse practitioner or a physician 24/7, 365. We can't even get a physician's assistant for school-based mental health or half the time. So getting one 24/7, 365 is pretty tough.
I guess there's such a need for detox. I mean, I hear that every meeting I
And
go
again,
to.
sorry, go ahead.
No, I mean, and so I just, you know what, I don't want Umatilla County to drop the ball.
I think this is not only not dropping the ball, I think it's running it across the finish line of the end zone. If you look at the, because I was, like I said, I thought the same thing. I think we need a detox center. But why? What is it you're looking for? I want somebody who's intoxicated and under influence to go to and get treated. So they're not going to jail. They're not going to plugging up our hospitals. But I also want the same thing for mental health. Detox center doesn't touch mental health. So the person talking to the telephone pole on Main Street, they don't get to go to detox unless they're under the influence. This one, they can go to a crisis stabilization center if they're under the influence or if they're having mental health or both.
I don't have any other questions. Can I ask something of the audience? Joe, can you speak on this at all?
I'd
Okay.
ask Alicia to
Alicia?
speak.
I mean, I don't think I can speak to it fully. I definitely agree with the statement that a detox center isn't going to be addressing mental health only crisis. And the only part I'm curious to learn more about is for a stabilization center, if they're not having the medical staff as needed in order to work with someone who's detoxing, that's been referred to the ERs. Are the ERs in the county saying that that's actually what they're going to do? Are they currently doing that? And what does that look like? And just confirming that partnership. So I don't want to assume what ERs are doing.
Well, we haven't had detox for over a year in Umatilla County. It's been over 12 months since they've shut their doors. So are they doing it now? Yes.
Have you talked to them?
I have not talked to them now.
Is there who's them?
The hospitals,
Oh,
so St. Anthony's or Good Shepherd.
I have not talked to the facility.
Okay.
But if they're, I mean, everywhere else law enforcement is gonna take them if they need medical assistance.
anything else on this subject? We're good? All right, thank you. The next item on the agenda is the Waste Connections of Oregon rate increase. Bob, you want to give us a background on
Yeah,
this?
I'll come give you the background and then, franchise holders are here today as well. Good afternoon. For the record, Bob Walder, Community Development Director, and also liaison to the Solid Waste Advisory Committee. So the item before you is a rate increase request that was received from Waste Connections doing business as Sanitary Disposal Inc. And the proposed rate increase was 14% within the franchise area of unincorporated Umatilla County. So if approved, the proposed rate would go into effect on July 1st, 2026. On April 14th, the SWAC committee met and voted to recommend approval of the 14% increase. And that caused our department to issue a public notice that ran in the paper of record, which is the East Oregonian, as well as it was posted at other locations. That 14-day comment period elapsed on May 13th. We did not receive any written remonstrances during that comment period. And so the Board of Commissioners is asked to hold a work session and provide an opportunity to ask questions of the franchise representatives who are here today. And so at this time, I can invite them up. And I'm also available for any questions if you have.
Questions? I have several. What's the 14% based on?
Come introduce yourselves and
Bob, did you want to sit here? There's a seat right here.
oh, there is. Okay, yeah, I can go down there and then.
Yeah, I'm sure.
Yeah, there it goes.
Yeah.
We prepared a packet, just kind of going over some cost comparisons with other haulers in the area. But then also,
Yeah, we need to state our name and,
Yep.
okay.
Oh.
Kevin Merrick, no, it's okay. Kevin Miracle Sanitary Disposal, 81144 North Highway 395, Thomas, Oregon.
Shayna Lilly, controller, sanitary disposal, 4536 23rd Washington, or sorry, Longview, Washington, by next district.
Oh, and I'm Derek Grant. I'm with Waste Connections of Oregon and sanitary disposal as well. 7645 Southeast 22nd Avenue, Portland, Oregon.
So,
Well, I
yeah,
was gonna say, I'll kick it off being
Yeah,
in details.
go
But,
ahead.
last year we came to the council and requested a rate increase of 30% increase, provide financial statements that showed where the 30% was going to go to cover our costs and our revenue base to support general operations. You were kind enough to grant us a 15% increase. And so we implemented that last year and then have rerun our same numbers again. And this year it came out to 14%. So pretty close to that original 30% that we asked for. 15 last year, 14 this year. So we're at 29%. And then Shane and Kevin have the additional financial statements on that.
But before he gets into that, yes, I remember last year's discussion. And we broke it all the way down to what your EBITDA and EBITDA was. And it was, we asked you what your operating EBITDA and EBIT was. And we matched that. We gave you 15% to get to that. Now you're asking for another 14%. This will put you over 53% in 4 years. I can't get there at all. I don't even know how to get there. We went to exactly what you guys said was your operating EBITDA and EBIT last year. And now you want 14% on top of that?
well, and remember last year when you guys did approve the 15%, we told you that's not going to get us where we need to be.
We told you not to come back with anything over 3%.
Well, our request last year was 30%.
Absolutely. I don't care what the 30%
Yeah, and
was.
you granted the 15, and we at that time, we mentioned that we would probably be back for 15.
Yeah.
In the following year.
And I have other issues too, but other questions on rates?
Real quick, is this just the unincorporated areas?
Yes.
So it's all Umatilla County that we pick up. I don't know if there's confusion with UGB and unincorporated, but it's our Umatilla County customers that we pick up.
So everything outside of the city limits.
Yeah.
In their service territory.
So basically, everything that we said no to on the $8 a month recycle. Well, plus the
Plus
UGB
the-
customers. So it's it's all the customers for garbage. So what did the city get? What happened there? Which one? Well, assuming this is Hermiston. So Hermiston did 37.5% 2 years ago. Morrow County did 37.5% 2 years ago. Ione, Echo, and City of Umatilla did a 3-year that still got them to the 37.5%, and Stanfield also did
37.5% along with Boardman.
And then this year they went to a CPI, so this year they got.
Yeah, it's 2.68 out there.
That's 37% over 3 years, from 3 years ago. We're at 44% from 3 years ago. So why the 14% is my question.
Because we're still not making the margin that, per the franchise that we could be making. We're still negative on, the haul or the, disposal. And I think we're at I don't have that piece. I think we're at 4.9% to the positive on the hauling side.
Okay.
So if we look at our last page, this shows our current financial position with adjusted 12 months of the rate increase. We came in last year, like you said, saving 30%. We've done a fully transparent financial review, expenses, operations, and our revenue to break out the transfer station in Umatilla County. This shows that still our net income before taxes, we've got negative 4.9% of the transfer station and 1.4%.
Why do you guys even want to be in business?
We want to continue providing service to the customers of Umatilla County. We just want to make that reasonable margin.
But you don't want to provide service. I've gotten 7 calls in the last 2 weeks where you've asked people to some kind of made up fee of drive-in service.
It's not a made up fee, yeah.
I looked through every price.
I think maybe the verbiage, it's a drive-in, walk-in, it's the
That's
same.
No, it's not. If I have to walk my garbage can out so you don't have to drive in, that just means your guy doesn't have to walk in. That has nothing to do with the drive-in.
Well, drive-in and walk-in for us is the same thing.
That is not the same thing at all.
It is.
Absolutely not.
Okay.
And so all of a sudden it went from a safety issue to now it's a revenue issue for you guys. And somewhere along the line, and tell me if I'm saying this right or not, that you're telling people that you only pick up garbage on the Umatilla County roads.
That's what the rates are based off. If we're to go past that.
That's not what the agreement says.
Yeah, the agreement doesn't say that we're gonna drive down every private driveway and pick them up for the same price.
When you bought the franchise, you were gonna provide the same service that was being provided before.
That was assuming that sanitary was doing it correctly and they weren't. So now we have customers that are paying the distance, the drive-in or the walk-in, and other customers that aren't.
So,
and so
who did the background on the purchase?
well, nobody's gonna go out and drive every single road to figure out what this customer did when,
They didn't give you route maps?
Well,
They did, but it's not to that detailed level. We're not gonna go drive every route when we're acquiring the company, so.
Well, there's nothing in this franchise agreement about public county road. You guys are making that up as you go.
we're not making it up, Dan.
Kevin, I start getting phone calls like crazy as soon as your people started calling out, telling people it's gonna be $7 to $10 to pick up a can.
It's because when the prices are based on the county road, the minute we turn off of them, it's fuel, longer hours, wear and tear on the trucks. I mean, we can't even drive down a county road without shoving a dual through a bridge on a county road. And the expectation is that we just can continue to do what we're doing.
That is the expectation. That's what a service agreement says.
Yeah, but when it comes to walk-ins or drive-ins, there's an additional cost for that.
And then 44%, we haven't made that up yet?
No.
Oh, absolutely. I am way off base here. We're telling people in Umatilla County that you're not going to get the service, but you're going to pay more.
For anybody who's on a private road that's not paying for that service, it's an additional fee, yes.
How are they not paying for it? They've been paying for it for years.
No, they haven't been. They have not been charged for the proper service level that they have.
Not that. To what you're changing the service level to.
I'm not
You're
changing.
changing the service level. Nowhere in this franchise agreement does it say anything about county roads. Nowhere in this franchise agreement or in the rates that were you assumed from the first year when you bought about a drive-in rate. Those are made up. Those should absolutely go before the SWAC before they ever come to us. And absolutely before they ever go to the customer.
The service level you're talking about?
Absolutely.
We can go back and take a look at the service level, make sure we're applying it consistently with the way the franchise is written and the rate sheets, and everything else along those lines. Make sure the other haulers look down here following the same process as well. So,
I'm talking about your guys', the unincorporated Umatilla County.
So let me ask this. Was the previous provider providing that service
Yes,
at an extra cost?
no, they weren't being charged properly.
So then when you came in as the new franchisee, and said, we're gonna provide the same level of service at the same rate, or how did that, what was the language you used?
So I didn't realize that this was such an epidemic when it came to a lot of these private roads. But we're not going out and looking for this. I'm not telling the guys, hey, let us know who's doing this so we can, get in front of them. It's as they're individually being brought to us is when we're addressing them to make sure that it's the same standard for every customer.
But it already is the same standard for every customer.
At the county road, not at a
No,
private
not at the
road.
county road. When this says you're purchasing and transferring the franchise agreement and not lowering the service level at the time. That's in here. And now you're changing the service. And not only that, you're changing terms of your rate schedule without bringing any of that to the SWAC or us. And then asking for 14% on top of that.
If we, to go back and even look at, that piece, so you're saying that's not in there. I mean, any private drive is an added service.
You assumed that service when you bought the franchise.
Well, regardless of that, they were doing it, the
Right.
company was doing it wrong, so we have to correct it. And I'm not gonna go to, because,
was there a rate for it when we bought it?
Yeah, there's a rate.
No, there was a walk-in rate,
walk-in.
Walk-in.
Yeah.
So what does
not
that
a
mean?
drive-in rate.
What does that mean? What do you mean walk-in rate?
Well, like if somebody, is, just walk up to their garage, say it's in a neighborhood, they walk up and grab it. Drive-in's the same, drive-in walk-in's the same. One, we use a truck if we have a safe place to turn around.
So
So,
the rates are generally set up for an automated service where the driver pulls up, uses the arm and tips a cart. He has to get out of the cab, walk up to the house, or has to leave his normal route to drive in, to a private drive. It's additional time and it's kind of a premium service in a way. So we're providing that additional service. So the rates are set up to, compensate for the additional time, fuel, and wear and tear on the truck essentially that takes place for that additional time.
So is this
But
just?
that's not an additional wear and tear. That is what you based your purchase on. It's not additional to anything.
Was there due diligence done on this, or is that the piece that's missing? Is that?
Yeah, acquisition, yeah, certainly there's due diligence done. I think, in general, you are a little, you can't do all the nitty gritty details just out of respect for the, employees and the sensitivity of the transaction. So you don't typically get out and drive the routes and do those sort of things, because then, employees will find out it just causes the transaction to go difficult. So we tend to get kind of bulk detail, and you have to assume that they're following the rate sheet and billing things out appropriately. It's not uncommon to purchase a company and find out that they may not have been doing it to the letter of the law in the past, or some companies do it perfectly, you just never know.
But my interpretation is the previous franchise holder was doing it perfectly as the franchise reads.
Yeah, I will have to check with Pendleton. We can check with Pendleton Sanitary. It's a good example and see how they handle those, because they have a customer base in the county.
Are we talking Pendleton or Hermes?
I'm just saying for consistency of service levels. I mean, if Pendleton's gonna be charging drive-ins in the county and walk-ins in the county, then I would imagine the other franchise holders should do the same because their rates are set that same way.
I'm not sure the comparison. I mean,
Well, they're both franchise holders providing automated service in the county. So they're providing the exact same service to the customer base. So they should be billing the customers the exact same way.
that may be up to you.
Yeah.
But that's
saying it's
not,
a good
that's not,
example.
that's, well, the example I have is the franchise agreement that you signed and bought.
Yeah.
The
And
franchise.
Pendleton's may say the exact same thing, they have the exact same language, and you may approve their service levels as well. So they kind of establish a process in place you've already approved.
But you guys don't think that the SWAC should have been at least heads up on this before you started changing the policy?
It's in there.
In where?
It's in the franchise agreement. Walk in, drive in, and out.
There is no drive-in in here.
Yeah, walk in, it's the same price. It's just verbiage. It's the same thing.
It's not just verbiage. That's the thing, Kevin. You say it's just verbiage. It may be just verbiage if it's inside a city limit where you have to walk from the curb to the garage and pick a can up. That's not the same as saying 15 people in a quarter-mile road have to pay $10 extra a month.
Well, I think, the piece that you seem, I don't know the proper way to say this, but the minute that we drive off the county road, that's extended wear and tear on the trucks.
But it's not extended
We
because
can-
that's part of your
Well,
purchase.
we can call it a walk-in, because it's the same thing. We'll
And
call
your
it a
guys,
walk-in.
if your guy's gonna walk in, if those people are willing to pay $10, I have no issue. But if they're not willing to pay it, you still have to drive in and pick it up.
No,
You're saying that you don't have to follow the franchise agreement.
we do on the county road.
Where do you, hand this down to Kevin and have him
Okay,
show me
and
where it says county
I'll-
road.
So instead of showboating,
I'm not showboating. I'm trying to protect the people that you're
get it.
charging rates 44%, asking for 44% more in 3 years and still asking to pay an extra $10 a can twice a month to get picked up.
to go down a private road that is farther and more wear and tear on the trucks. We can go back, if you want to set the rate for every private road, we can go back and look at what that
Why
is.
would I, as a county commissioner, want it to redo the whole franchise agreement to start identifying private roads when all of the roads are identified in there?
Well, yeah, but you have to pay for that additional service.
No, that's what why would I have to make constituents pay extra for what they're already getting?
Because they weren't being charged properly in the past, and now we're writing it the correct way.
It's not writing to me, that's making it different. That's a whole different proposal program. It's been 3 years and you haven't done that.
This has been in place. People are being charged for this all the time, in the county, out of the county, in the city. Everybody.
I need to see that.
Okay, I can show you.
Okay.
It's not anything that's gonna happen right now.
No, I get that.
But I'll get it.
Okay.
Cause there's a lot.
For the last 3 years, you've been charging an extra $10.
There's people that have been in our system that have been charged prior to the
In
acquisition
the
of
city,
the
yes,
company.
but,
In Umatilla County.
okay.
Yeah.
You show me where unless it's, if it's a walk-in, I have no issue with a walk-in if you're walking in and getting the can.
Yeah, I know, I get it.
Well, I have a question on that. So I live on Miller Road outside of Milton Freewater. But then right in front of, to the east of me is Keel Lane. So if you go down Keel Lane, which is maybe an eighth of a mile, there's 3 cans back there. The driver never gets out, and plus ours, right? So it'd be 4. So the driver never gets out, goes down the lane, picks them all up, turns around and gets back on Miller Road. So are you calling that a private lane?
I don't know what.
If it's not a
lane
county
it is.
road, he's calling it.
So it's not a county
Yeah,
road?
anything that's not maintained by the county is considered a private road.
So you would charge each one of those folks that are getting those 4 cans on Keel Lane, even though the driver never gets out of the pickup or out of the truck, would get an extra $10 charge,
Yes.
plus the charge that you're charging them.
It's it's a premium service to go down a private road versus picking it up at the mailbox or the county road.
So let me clarify, Cindy, you said an eighth of a mile, correct?
Yeah, it isn't even an eighth of a mile.
So in that instance, would you try to drive and it's only an eighth of a mile, they're not going down over a mile or anything like that. They're picking up 4 different customers.
It's still, yeah, to stay like we're charging everybody, it's still that price. Because everything, it's like I said, everything is based off the county roads.
I've only got one thing to say on this. And we're always glad to see you, but you know what? It hasn't even been a year. Okay. And when you very first bought this, business, we chatted off to one side. And then later on down the road, Commissioner Doran said, oh, this is what we're going to do for you. And do not come back next year and ask for anything else. And your parting comment was, I will not be back. You were back.
Yeah.
And you've been back continuously since then.
Yeah.
So I guess my question is, I appreciate business is tough right now. Business is really tough right now. But on the other hand, what have you folks done that you've tightened your belt? And not charging customers, $10, not raising your rates or charging customers more. I mean, what have you done within your business to streamline that down on your side?
So we took the drivers from 410s to 5.8s. We did a complete reroute of all of our lines of business, which is rear load and automated side load. And so we basically, instead of drivers driving, crossing each other and having routes over here one day and over there, all the drivers are in certain areas every single day, at least on the automated side. Commercial's a little bit different because of multiple day pickup. So we've done that. The reroute that hasn't been done in 30 years, that's a long time. And, the efficiencies that we gained when because our drivers were working crazy hours. And, now they went from 56 to 57 hours a week. Now they're down between, 45 to 48, which is more of a work-life balance. So we ripped the Band-Aid off when it comes to a reroute in order to, kind of consolidate what we were doing. But, when we first got here, I'm new to the DM role, and, I'm used to a bigger machine that's ran well. And just bases everything off CPI, knowing that you have, your right rate at the beginning. Well, I didn't realize as a young district manager what I had actually walked into. And I had my team at the time, which is Shannon and Brian, our conversations over and over were how we were hemorrhaging money. And I mean, for us to be in the negatives at the transfer station after this is just crazy. And so I was under the assumption that, oh yeah, this is all we're going to be coming in and asking for. And then as we start going, we start getting years under our belt. That's when I went, oh, okay, this isn't working. And I think for me, one thing that I learned is that if I'm ever put into a position like this again, that I'm going to let everything cook for a year so we can come to the table with one big ask versus kind of what we're doing now. And that's totally on me. It's totally on me.
I respect that answer, but I got a quick question.
Oh, wait a minute. I want to follow up. Just hang on a second. So you redid your routes. So what kind of money did that save you?
I don't know off the top of my head how much it saved, off the top of
About
yours.
20,000 a month in overtime.
20,000 a month in overtime.
And that is reflected in the financials that we're showing you guys today. So we were able to take that and kind of put that into our financials on a test period basis of now that we're done the reroute, we're saving money. What do our financials look like with that in place?
Yeah, because we're not coming in at 15% plus CPI. We're able to get it down to the 14.
And because of those efficiencies, we're not coming back in for about 17%, 17.5%. We've been able to come down in at 14%.
And so how much would, it's ridiculous. I didn't even ask.
Okay,
Well,
so
my question is, how can you run your business and not, I'm sorry, I kept cutting you off. I'm sorry. I
you're
don't
good
want
at
to
that. I'm
trade.
used to it.
I'm sorry. But my thought here is, how can you run your business and not have those overtime costs?
Which overtime? The one,
Your personnel overtime costs.
well, you do have overtime. You just don't have the unsafe overtime, which is at 55 to 57. I mean, nobody's going home for dinner when they're working 57 hours a week, especially driving a truck.
So I guess my question is, how is it you can run your business and not pay overtime costs?
We still pay some overtime. It's just that we were able to, when we took all the routes and made them more efficient, the overtime came down. So we're able to do the same amount of work with just less work hours by aligning the stops a little bit better and aligning the routes so that they weren't crossing over each other.
So there's no way you can run that business without having overtime. That's what you're saying.
Right, yeah, you're gonna have breakdowns, you're gonna have things happen. Our target route, we want to get people in 40 hours, but I'd say most weeks are probably 45 hours.
And we added a day too. So these guys, our automated guys were between 42 and 48. And when we added that day, it thinned them out even more. But then we were also able to bring our rear load piece down too, which was high, and we added some drivers to that and another truck on the road to reduce the amount of hours.
So we have been looking at areas where we can streamline our operations and where we can cut back. I guess, and to run more efficiently. I think that was part of the conversation last time. And so we've looked in those areas and been able to reduce a couple key things.
Now can I go?
Right, yes.
So 2 weeks ago, you're in front of the board asking for $8 for the recycle, for the unincorporated areas. The board said yes to part of it, but not to the unincorporated areas. Had we said yes to that $8, would you still be coming to us at 14% today?
Yeah, it's a total separate cost.
Okay, that's all I needed to hear.
Yeah.
So I'm gonna ask this. But don't get the wrong idea.
Careful.
If you were allowed, if the SWAC and the commissioners allowed you to just run on county roads, what would that savings be?
I do not know off the top of my head.
And you're still asking, you don't know what that would be. You're out telling people that, and you're still asking for a 14% raise.
Well, as much pushback as I'm getting, just trying to get them to get it to the county road. And I mean, yeah, I can look at it, but if you're gonna make me go out and actually
I'm not
intentionally.
making you, you bought the franchise.
It's so fun. I don't know what the number is off the top of my head.
I would love to know how you could run that business and not pay overtime.
We're paying
We do.
overtime.
And not pay overtime.
Oh, well, that's difficult with trucks that break down, drivers that call in sick, construction, injuries, incidents. There's
You'd have to build the routes for 35 hours, expecting to have weird things happen that would push you up to the 40-hour mark, and you can't find employees that are gonna only work 35 hours a week. It'd be next to impossible not to have overtime.
Yeah.
In our industry. And we have sites where we pay guarantee time. So if you get work 6 hours, you get paid 8. So we have it set up where they are marked at 8, and we still have overtime in those markets as well.
Okay.
Just because of the nature of the beast.
Thank you.
Other discussions, more from you guys?
You can talk too much.
And I understand your frustration, but I think when you look at the rate sheet too for the different municipalities, this gets you to a point where you're I don't remember exactly, Shannon's got it there, but I think it's in line with all the other service areas, and that's what our goal was, to try and get all the service areas to about the same point, same standards for profitability in our industry. You know, it's 8 to 12% on net income. That's our normal profitability in the industry. Most of our contracts are written where it's a guaranteed 8 to 12%. This franchise doesn't necessarily have that. But you know, our hope is to get everything to the point where we're just, it's a CPI increase, and that's all we're kind of asked for. Kevin loves this process, I can tell. However, you know, the goal is to get to a CPI situation. We're there with most of the cities at this point. So I think all the cities at this point.
So are all of your folks that aren't on a county road paying this $10
Not yet.
fee?
As we're finding them, they are. But when we
How many
took
have you
over,
found?
I don't know off the top of my head.
I have been pre-acquisition, there's probably a fairly good number of people that were being charged this drive-in walk-in fee, right? And as we continue to work through it, we're finding more people that weren't charged. So I think it was being charged before we bought the company. It just wasn't being charged.
That's easy enough to find
Wasn't
out.
being
We
charged
can go to the past owner
Yeah.
and ask them.
Yeah, we
I
can,
mean, that's
we can
easy.
probably have that billing details. We can show you, hey, they were billing some people, but not everybody.
And
we
what
wanna
were
make
they
sure it's
billing for?
consistent, so.
Walk in, and what were they billing for? Either walk in or drive in. It's not the same thing.
I think it's a misnomer in the contract, and I think that they used it for the same purposes, whether it's a walk-in or drive-in.
Well, it's
They
the
bill it
same
that.
term as in the city. I can see that being
Yeah.
a term in the city.
Well, and I can pull that information out of RMO.
Yeah.
And we can determine how they're charging it, and then I can verify against the address if it looks like a drive-in or a more walk-in situation.
And they probably go to the past owner. They probably got an old Excel spreadsheet that shows you exactly how much they charge.
I think it's also important to make a distinction. So we have county roads that are open to the public and maintained by the county. And then there's public roads that are still open to the public, but maintained by those adjacent landowners. And then we have private roads. So there's 3 types of roads that we have to factor in.
And right-of-way roads.
And I believe there are a number of roads that you serve that are just public, not county roads. Do you charge people living on a public road?
As long as it's maintained by the county, then we'll drive on it and they don't get charged.
But there's roads that are not maintained by the county that are still public.
But who's maintaining that though?
How would you know?
The landowner.
That's what I'm asking. But I mean, even then, those roads aren't meant for the weight of our trucks. So, I mean, even some of the roads that we're driving down now are just sand, and we have a 56,000 pound truck driving down this thing every week. The roads just aren't maintained. I know.
Can't argue
I
that.
know.
But you're also probably using private roads to cut through. I mean, like Beeson Lane and some of those that cut and make your routes shorter. Do those guys get a credit?
I don't know off the top. I mean, I would
No, they
have
don't
to
get
see this, but I'd have to see the scenario anyway, but yeah, they don't. This is so fun for me.
What do you think it's for us? It's
Yeah,
not fun
no.
for us either.
I think you're having fun, Dan.
No, I am definitely not having fun. I would have had fun if this came in at 3.5%, 4%. We argued about a quarter point.
Do you have folks then that are not gonna pay that $10 fee and are taking their cans out to the county road?
Yeah, there's some people that
How far are
decide,
they having to take their can?
it fluctuates. Just depends. It could be a mile, it could be, 300 feet, 50 feet. For me, this isn't uncommon. They're called group settings. And when you have a handful of customers that live on a private road, some of them, don't want to pay that additional fee. And so they
Or they don't want to start it down the road.
or they don't want to strike down the road. And
Or,
So the-
or they end up like the other 2 calls I got is my neighbor's putting his garbage in my can.
you get all your neighbors.
Yeah.
Yeah.
So it's,
So let me ask this, and no, I'm not in the garbage business. But in the scenario that Commissioner Timmons just outlined just a minute ago, You got 3, 4 houses at the end of one road, all the cans are there. You're gonna go down there for 1 can or 3 or 4 cans. So why not just charge the area the $10 and not everybody $10? I mean, if you're gonna go down there once,
Well, who do I charge?
for sure tenants. So that's an easy.
I mean, we,
I think part of it is that, people can come and go from service. Somebody may be on it today, we may split it 4 ways and it's $2.50 for everybody. But then they stop service tomorrow. Then we gotta go back and re-edit the services so that it's $3.33 for the other 3 homes. And so I think the administrative piece of it becomes.
I think that what we're really gonna have to do is, this is gonna need a lot more detail than what we can do here. For
Okay.
sure. Bob, obviously, if you're gonna change a franchise, I don't even know if the SWAC can change a franchise agreement outside of race. I don't know,
the board's
board's the only one that can change it.
Oh, more good news for you.
So, I think you've got your work cut out for it. Sorry.
I mean, we're not.
Bob's been the quietest and he's getting our.
I guess, I mean, I would like some direction on, do you want to, we have the recommendation in the SWAC. We want to forward on the rate increase. We want to forward that to a commissioner meeting. We have to deal with that somehow, whether or not.
Yeah,
deny it or modify it.
I would say go ahead and bring that. But to me personally, I think some of these other answers will have an influence on that rate because
Yes, legal counsel on the clarification around the drive-in fee, could they modify that in the rate schedule as part of, with the rate increase and that schedule that's presented? Could the board modify that to, it sounds like in waste, in sanitary disposals line, walk-in fee and drive-in fee are synonymous. So can that be added to the rate schedule?
The commissioner.
that'd be a separate subject in the rates.
Well, I was wondering if it could be done in the same motion.
Depends on how quick you want this to come back, because I wouldn't be comfortable to even walk in to drive in or walk in to drive in just unilaterally by any means.
I have a question for you. And I'm not siding with Dan here, but I just, how do you say that walk-in and drive-in are the same? Just because one gets out of the pickup or gets out of the truck, the other one does not.
I just.
How do you clarify that, or how do you?
When it comes to, because there's so many different scenarios. Just getting out of the truck, you could be walking, because we can't get the truck down there. And maybe somebody has a hard time getting their can out. It could be, 300 or 400 feet that the guy's walking. So it's just the same price. And if you guys want to look at the pricing from walk-in to drive-in, then we can do that.
I would guess that the likely scenario is that when unless somebody was here when the franchises were built, that the franchise was built with small trucks and a different type of service level. And they didn't have a drive-in. They just drove everywhere on their small trucks. And if they did have to walk in, there was a walk-in fee. Then over time, they automated the system. The prior owners are the ones who automated the system.
Yeah.
They probably didn't come back and say, oh, we need to change this to walk-in, drive-in. They just left it as walk-in because that's the way it always was. And started using it as a walk-in, drive-in, the same. They didn't change the name on it. They still build it like that. That's probably what happened. We see that a lot where, a lot of the service that's now provided roadside, where people have to carry their service out is for that same reason, that people just don't, the trucks have got bigger, more compaction, all these different things have happened over the years in the industry. And so it's just a different service than it was 50 years ago or whatever.
But the other part of that, Eric, is a lot of our county roads, there's nowhere to put a garbage can.
Yeah. Oh, yeah.
They're-
I know it presents a lot of issues to bring out to the road.
I mean, now we're really creating safety issues.
Yep.
when we ask them to bring it either side.
Yeah.
May not have, not even a shoulder, let alone a fog line.
Yeah. And I would say just as many of those that we're having people bring out, there's probably just as many people that don't want us going down the road for a variety of reasons. Most of it's wear and tear on their private roads or whatever it is. So there's a lot of people, we'll get 10 houses on a road and one person will say, I don't want you on my road. And we have to refuse that service typically.
To
Because
everybody
1 out
on the
of 10
road?
That's the way we tend to do it. We, unless they're willing to, unless the other 9 people are willing to sign off on the damage release form, you know, to cover that person, you know, so that they would agree to pay for any damages. You know, sometimes we can work through those, but typically we would not service that road if one person. And then we get in the middle of a neighborly dispute, it gets really ugly, and so we're kind of, you know, hey, somebody doesn't want us driving down the road, we're not gonna drive down the road.
That'd be unusual to me for twice, especially in this country where everything's heavy. You know, I mean, if you drive down those roads, there's travel trailers and everything else.
Yep. You'd be surprised.
That for 2 trips a month.
Or they don't want to provide a turnaround, like they don't like where we have to turn around is a common one too, because a lot of these roads are built and there's not a place for a garbage truck to turn around, so we have to use, you know, Steve's driveway, but Steve gets upset eventually and I don't want to turn around there. We don't have anywhere else to turn around, so we'll refuse to have to use the service for the group.
Or there's just absolutely no
Or there's no-
turnaround.
Yeah.
Yeah.
So what I think I'm hearing is we'll bring the rate request to the commissioner meeting for a decision on that. And then we want to separate out this discussion on walk-in driving.
Yeah, along with county roads and the franchise agreement and all of that.
So that might be something that could be a future work session then, because I'm guessing sanitary disposal is going to want to do some information gathering
Mhm.
and we can bring that back.
But going back to the rates, I saw there was a request to by 30% or whatever to raise the walk-in rate.
It was 14% across the board. So the walk-in charge listed on the current walk-in charge is $6.92. If the 14% was granted, it'd be $7.88.
I have the calls I'm getting are saying $10. That would,
Okay.
They're probably just rounding up.
Yeah, it's kind of like 692.
but the people that are calling me or sending me emails say that you're telling them $10.
Yeah,
I can verify what we're billing and confirm before our next session.
Okay.
But I'm pretty sure we have it as a defaulted rate. And so our customer service team, they simply select that code and that defaulted rate comes up and they can't alter it. So
So your default is $10.
no,
No,
692.
You bought $6.90.
A month?
People that people that are calling me are either saying that you're telling them $7 to $10 or $10. $10 is the most common one.
Well, not in Umatilla County. In Umatilla County, it would be $6.90. We wouldn't bill anything other than what's on the rate sheet. So.
yeah.
Okay.
Little off topic, so can you define overfilled can / cart?
1 inch.
That's a good question.
The 1 inch, is that what it is?
No, I think it's typically 45 degrees. That's kind of what we go with. Does that sound right, Kevin?
45 degrees?
45. That's almost 90.
No, she's pretty close.
Elbow up, hand down. There you go.
Really?
90, 45.
They have cameras. So. Yeah, they have cameras.
With a protractor on it.
Man, I'd be your worst customer. You can know mine would.
Okay, no, that's all right. I have bigger.
Does that help, Bob? You got direction?
I think so.
We need to hold off on all the.
I'll bring the rate back to you at the next opportunity, which I believe will be the June 3rd meeting.
Except for the walk-in.
And then the walk-in drive-in discussion will be later.
Ongoing, because this is so much fun.
That is interesting. I didn't know there's.
I think
such a
we're gonna
thing.
need a little legal help on this one too.
Thank you. Thank you for good information.
Thank you, guys. Thanks, Kevin.
So if it's,
If I was a
it's a windy
drinking man,
day and the 45 it's blown open, do I get dinged?
No, but your scenarios are fun though.
He has everything better to do.
And then we go.
So we're not voting on it or?
Not in this
No.
meeting.
Thank you all.
Thank you, guys.
Thank you. Thank you.
Which one?
I don't know. Thank you, Dan.
Unless you want to hang out with us, I mean, you know.
Thank you.
Robert, can you hand me that? Yep. Thank you.
Oh my gosh, have you two been sitting here patiently this whole time for this?
Okay, I'm on Slack.
Or do they have questions for you?
Bob, thank you very much. And I know it's a lot of work.
Oh,
You can wait till you get outside the door before you cuss us. All right, so moving on to the next item on the agenda is the. Oh, shit. Oops, wrong.
Expansion of home visiting.
Expansion of home visit.
Do you want the clicker?
Sure.
Oh, boy.
I think only one or two things have changed since I submitted it. Because, you know, that's what happens.
Walk in church.
I heard that, Robert.
Okay. Shingle shop today.
So I'm Joe Fumar. I'm the Public Health Director for Umatilla County Public Health.
Alicia Lundgren, Deputy Director at Umatilla County Public Health.
So what we've got is we've got a project idea for expansion of our home visiting service, specifically our nurse family partnership into NFPX, which is just an expansion of some of the criteria for that particular program. So rural health transformation funds, I know a lot of folks, I think you guys are aware of the application process that is open right now. Oregon Health Authority is actually carving out, for lack of a better phrasing, some of these funds directly to local public health authorities. It will come through our language is program element 82. That is not, there has not been an amendment that has come forth yet, but we have already been presented with templates and materials to do submission. And for full disclosure, we submitted our project to OHA last week because that was the due date we had by them to put something forth. We have not yet heard back any response from them on this. So everything I'm gonna, or almost everything I'm gonna talk about as far as our projections are numbers that are in flux, and some of this process can change. And there's an aspect of the rural health transformation funds that changed between when I submitted this to you and today. So I expect there will be more changes in the future. We just don't always know what they are. So a little bit of background. Our current nurse family partnership program, in order to qualify to be a client in that program, you need to live in Morrow or Umatilla County. That is in part because the contract we have with Morrow County, where we administer this program on their behalf, and they provide us funding. And I think the way that contract is structured is they provide the costs of half of one of our nurses for administration of this program, whether that nurse is seeing a full caseload of their clients or not. So you need to live in Morrow, Umatilla County. You need to qualify for OHP. That's how we identify the income requirements for this program. You do need to be a first-time mom, and you must enroll prior to 18 weeks or 28 weeks of pregnancy. After that point, you no longer qualify for the Nurse Family Partnership program. Our projected FY27 budget, the numbers that were presented to the budget committee, because I think the process still isn't finalized, are listed there with a total revenue of 412, expenses of 711, with a potential general fund support of almost $300,000. The client data is our FY26 data.
So July 1 to last month.
Goes through April. gives you an idea of the workload that program has in place. So looking at our past budgets, we, especially in this program, have done a good job trying to budget high and come in underneath those projections. A lot of our stuff fluctuates. There's a lot of difficulty with some of the estimates that we try to put forth. And so this is just kind of putting out there that our process is to budget high, and then to try to beat that by coming at a lower piece and seeking other funds. Any questions on this slide before I move forward?
So it kind of rounds out to like $2,500 a visit. Is that kind of, am I looking at that right?
It can. There's a lot of pieces that come into play. The billing for this is TCM, or target case management. So it's a set amount based on the on visits that qualify as being billable visits. And then there's a lot of work that's supposed to cover. Doesn't fully cover everything, but it's just kind of the way the process.
One other piece that I would add, and I'm trying to pull it up as quickly as I can, is it really depends on the year, how many visits we have. Last fiscal year, so this fiscal year, we were at like 292. If I look at calendar year 2024, because that was how I ran this quick number that I have, we were at 363 visits. And in calendar year 2025, it was 290. So it can really fluctuate either on our caseload numbers or who's on our caseload, whether there's someone that requires weekly visits. Right now, we have a lot more people on our caseload that are just requiring monthly visits.
So is the heavy expense not on the visit, but on the caseload then? Is that right?
Well, on staffing,
Or, I mean,
maintaining
on
the staffing, yeah. So I mean, you can have the same amount of caseload and they're not as high acuity, and so you're not doing as many visits because they're not
Gotcha.
needed, and you can have a higher acuity caseload than you're doing a visit.
Thank you. Yeah, and I should have specified that clients who enroll into this program are able to stay in the program until the child turns age 2, or that they choose to disengage prior to that.
Yeah, so sometimes, like, we enrolled a lot of people in the fall of 2023. So 2024 was when we had a lot of pregnancies and births happening, and then 2025 was a lot of 1 to 2 year old toddler years. So then that's kind of really common when everyone switches to monthly. So sometimes it's cyclical in what the makeup of our caseload is, and if we have a lot more pregnant or toddlers.
Is this kind of like Kid Sommer's first 1,000 days of child's life? Is that part of this?
No.
Just
Let's just leave that brief and say no.
The Nurse Family Partnership Program does have a lot of data. It's a fidelity program. It shows a lot of data showing that clients who successfully go through these programs show downstream effects later in life. Everything from graduation rates to maintaining jobs to just engagement downstream.
Right. So there's like 40 years worth of randomized controlled trial research behind this work that's being done. It's seen across the US, it's seen in other countries just because of how much data is behind it, showing that their 3 main outcomes are increased self-sufficiency of the family, improved pregnancy outcomes, and improved health and development of the child.
It's funny you say downstream because Kid Summer Health is upstream. So I'm just saying.
Yeah, but they've done data with NFP model specifically that has shown when you work with families at this time of their life, you can then replicate that in future pregnancies that they have and to the next generation. And they've shown that with their data. Hence, at least we've appreciated working in an evidence-based model because we see the value in that. Even if it's not a high volume of people, there's the impact that you're making beyond just.
Are you getting to everybody that you think needs it? Because the reason I asked that, I think at our hospital board meeting, St. Anthony said they had 650 births and Good Shepherd had like 796.
The short answer is no.
Okay.
Yeah. And I will also say that we work in partnership with Umatilla County Head Start and Yellow Hawk Home Visiting they have different eligibility requirements, and we're part of a shared referral network so that we're working together to get anyone who's pregnant referred and then staffed out to a program that can service them. So we may be serving this number of people, but there's more people being served with home visiting services. It might just not be NFP.
So there's different programs.
There are, yeah, and we try to coordinate that so that, just for easy math, if we have 30 home visiting spots, we're not serving 10 people 3 times amongst the 3 agencies. We're truly serving 30 different people.
And you have folks, probably in your program that, I mean, you have a population that you're targeting, correct? I mean, just like, Dan said, is that you might have 1,000 pregnancies across Umatilla County, but the group that you're trying to spearhead might be 150. Is that
Who
right?
we're actually looking for, yes, with NFP, definitely we're looking for a very small niche
Right.
of that 1,000 births.
Okay.
But that's why we like partnering with the other agencies that can serve a broader expanded eligibility so that it's many families as we can are accessing services
And you have to be
Okay.
OHP members.
for us,
For the
But not-
NFP.
not necessarily for the other ones.
Okay.
Yeah.
Thank you.
And you do the billing? I mean, your
Yes, our
department
office
does.
does.
Office does, yeah. All right, so, rural health transformation funds, this chart is, portion of this chart is in the applications that have gone out. I put this one in because it showed the years 3, 4, and 5 periods that is, I'll just say yet to be determined what that rollout and what the access to those funds will look like. Typically, the projects across this have to be new or expanded. The way OHA has been able to roll this out is we're able to essentially combine project periods 1 and 2. This is also the slide that has a change. So at the time I wrote this, all personnel expenses, well, actually, I get the way I phrase it, nothing changes there. Personnel for period 1 can only be spent in period 1. Personnel for period 2 can only be spent in period 2. That has now changed across the applications. Is they're actually looking at that across 1 and 2 now. That was a recent change that OHA kicked out. So for other projects you might be looking at tied to this.
Yes, thank you. I appreciate that.
The way that it is it's tied to the federal fiscal year, but in our case, we're receiving $303,000 through program element 82, assuming OHA approves our project and everything moves forward. All personnel expenses will have to be expended by the end of October 2027. You do have almost a year for other expenses as non-personnel. I don't foresee us looking at that, but just calling out that everything here has to be new or expanded. In our case, because of the carve out, it has to meet the outcome 4 requirement, which is increased rural populations served by new health and social health services. So here's what we're looking to do. We're looking to expand our nurse family partnership, NFP, to NFPX. What would that look like? What would that be? So we would want to recruit a full-time home visiting nursing supervisor that would essentially take over some of the work Alicia's been doing with supervising that program. I can tell you she does not, her time of her day is carved up many different ways. This would allow for taking some of that off, being able to really focus on expansion of the program. Along with that, we'd like to create and recruit a full-time community health worker position, ideally a Spanish-speaking bilingual one. The supervisor position would be set up to be half-time supervision. That is a requirement for the Nurse Family Partnership Program based on the number of nurses we have seeing clients. We have to have a minimum of a 0.5 supervisor position. The other 0.5 could be actually conducting visits, which would give us expanded capacity to pick on additional clients. The community health worker would support both the bilingual clients, work to increase referrals, and can actually conduct their own billable visits underneath the guidance of the nurses. And so it would allow us to access some billable revenues through that, where some of the case coordination can be handled through the community health worker instead of the nurse, who can then be on to seeing other clients, is the thought. What NFPX gives us is you can enroll anytime during pregnancy rather than just prior to 28 weeks. and you no longer have to be a first-time mother. So if this is maybe your second pregnancy, but you meet the other risk categories, we would be able to enroll you into this program. Is there anything else you want to say on that piece?
That's correct. It is required that at least 50% of our caseload is still traditional NFP enrollment if we do end up going to NFPX. So that'll still maintain being the focus, which is important because expanding to this eligibility does dip us into pools of people that the other agencies are able to currently serve. And so we want to make sure we're getting enough referrals in, serving enough families, as Commissioner Doran was pointing out, but not dipping into other people's territory too much and playing good in the sandbox with everybody, but
Yes.
being able to serve more families. And our community advisory board has also said, like, because we're the only home visiting program of those three agencies that it's a nurse coming in. And so there are high-risk families that are not a first time or did not get referred before 28 weeks. And it would be beneficial to be able to serve higher risk families still with.
So what's some of the funding look like? So obviously we would be utilizing the 300,000 from Rural Health Transformation Program. Some of the one-time costs we anticipate with this, there are some essentially startup fees for the NFPX. That cost includes the required training that's tied to that program, both for the new staff who would be picked up, but the existing staff we have on staff would be required to go through that same additional training. This is home visits. This is going out, visiting at the home. That requires travel. And so we've written in the cost county car, which we believe how do I phrase this? Because we wrote it and we haven't heard back. Rural Health Transformation funds are not prohibited from being used on if we have approval from OHN. So the goal is to utilize those funds to purchase another car through the county fleet fees. There are some annual fees as part of the Nurse Family Partnership Program, and we would cover those for that first year of expansion. There are some additional just increased costs with our EHR.
Is that licenses for EHR? Is that what?
It's the maintenance fees, service fees, with monthly costs for our EHR. That includes
It's not
tech
just-
support.
You get like a certain amount of like licenses, I guess, for lack of a
We
better
do
term.
have a certain number of people that can log into it.
And so you'd have to increase that and get more.
No, ours is based off of the providers, not the nurses, correct?
It is still based off of that, but the reason why it went in here, the cost of our EHR won't change by expanding overall, but the way that we do cost allocation, where it's based off of FTE in each budget, there's now more FTE in this budget that's gonna have to pay towards the EHR, so more of the EHR fee will be hitting in this budget, but the actual cost of the EHR won't change. We have enough
That's-
licenses to cover this number of staff being added in.
Other things RHTP can cover for the period in which we have those funds is the personnel costs for the supervisory, half of the supervisor position and any of the onboarding train up until it gets to the point where they start seeing clients, because RHTP cannot be used to cover what is otherwise billable costs. And so once they get to the point where they are half-time seeing clients, that portion of them can no longer be covered by RHTP. You see where we're going with that?
I do indeed.
Yes.
Yep.
Same for the CHW, startup, a lot of the initial training, et cetera, and then some of the non-billable activities that the CHW would be performing can be covered by RHTP. And we would be having to parse out these duties for those staff to make sure we're keeping that in alignment.
So, and we've talked about this before. I just wanted to just double check because I'm getting ready to fill out an application.
Yes,
So you're you're not going to be part of the application.
correct, correct. All right, so another piece of funding that is out there. The Nurse Family Partnership, the National Service Office.
Yes, they're called Change It now.
Has a process where we can apply for And by going into NFPX, and if we pick up additional staff, caseload, as we're trying to do with the supervisor position, they will cover, if there's a 3-year commitment to engaging in the program and the staffing that we're looking to pick up, they will cover 33% of the cost of seeing the clients for that period of time. So we have a half-time supervisor and we have half-time seeing clients. 33% of that half-time can get covered for 3 years if the county has commitments to cover the other pieces of it in whichever ways we have to do that. Our anticipated piece of that would be about $36,000 a year to cover that portion.
Is what we could apply for.
Is what we could apply for. This is not a guaranteed, but we think we would have a good chance at acquiring this once we have a supervisor.
Yeah, they offer this fund quarterly. And so Joe and I had talked about, we would time applying for it when we know we've got someone coming in, because we know nurses are hard to recruit.
So overall summary, this is a program that does receive general fund support. Both from a standpoint of the billable revenues don't 100% cover the program, but also that there is a match component to the TCM billing that has to be provided in order for us to receive those revenues. Our best estimate as of today is in looking at what the ask was put forth for the FY27 to the budget committee, is it could be as high as an additional $40,000 in general fund ask. 30,000 of that would simply be the match increase for the TCM billing based on the revenue projections we think we could get to. And as we try to look at FY28 and we add even more forecasting into our crystal ball at what costs and things might look like, and be lost then or having used up the rural health transformation funds and without currently having anything to replace that, it could be as high as an additional, and then again, additional from the FY27 current ask, additional 180,000 in general fund, over 100 of which would actually be the match for the TCF. And would leverage about $340,000 between the two programs that we intend to get funding for, and then 36,000 in the second year. There'd be another 36,000 in the following year, but we did not try to project costs that far out at this point. Okay. Some additional considerations. Things that are going to or could change those general fund numbers, I think typically are across the board in a downward direction. We have started conversations with Morrow County about the incorporation of the community health worker into the services we're providing for them as well. They have, the health department there has indicated openness to that idea and actually liking that idea. What we've talked about, or maybe we've talked about, I don't think we've gotten granular with them yet, is that we would likely build that cost based on the hours that they're serving Morrow County clients versus the way.
50-50 split.
No,
correct.
not on this one.
But it would be as they get utilized for their clients, we would bill those costs to Morrow County as part of that contract.
What do you anticipate in your budget, Morrow County being?
What that cost would be to
For the
them.
CHW,
I'm not even beginning.
we're not sure yet.
Yeah, because the CHW is not even built into the cost scale, so we just made a guess at where it might sit on the scale. So there's so many unknowns with that.
So really, if they say no, then then they're just out and we go back to this building.
Well, correct. I mean, we just, if they would say no on that, we would not utilize the CHW on their clients, which would be very awkward.
That'd be
for us,
really
but
awkward for us. I really don't want it to
that's
have
what
to
it would
go
have
that
to,
way.
that's what it would come down to.
I think they'll say yes.
I do too. I mean,
I think they will.
they've indicated, agreement with this. Ultimately, everything comes down to the dollars, right? I mean, we just haven't had those discussions yet. We've opened discussions with McVie to potentially increase their support to our program based on an expanded caseload. And they have the initial opening of that conversation has been favorable from a standpoint of them willing to sit down and engage with us on what that caseload increase would need to look like and what those and being able to then look at what those dollars might be. We have a meeting with them later this week to kind of try to work some of that out, which could increase some of the supports that this program receives from one of our federal sources. There are currently discussions taking place at the state level to increase the TCM rate payment. It's not anything we are directly involved with. It's more we are aware these are happening. If that goes up, our potential for revenue also goes up.
I don't think the rate's been reevaluated for quite a while, so I definitely think it would go up based off of cost analyses that they would run for that.
We don't know what periods 3, 4, and 5 for Rural Health Transformation Fund are going to look like. We definitely have thoughts on how we would leverage with additional expansions if that's something that becomes a possibility. And so those are possibilities out there that we may be able to leverage in the future. Right now, there's no looking at what those numbers will look like.
Hey, Jill, or you, either one. Do you guys know if most of these dollars are Fed pass-through dollars, or are they straight general funds from Oregon?
For the Rural Health Transformation, and that is all Fed pass-through, is my understanding.
Okay.
And then we're exploring the opportunity, especially with the inclusion of a community health worker, to add in for our MAC pool to this program. There are some counties who have successfully done this with community health worker and the nurse. And so we are exploring what that looks like. We have to make sure we keep our federal dollars separated, keep our qualifying items, activities, but that may be a way to draw some additional funds into this as well. That would help the program.
But MAC would not be in that loss. I mean, MAC would be just a straight pass-through on the business. Or would it be additional money to our general fund?
Well, it would be additional money to the program.
Yeah. I mean, MAC,
That comes from the state, right?
Well,
it's the way that we do it at the health department, it's a random survey of 4 days over a quarter. And then as you have qualifying activities, there's a formula they use to then give you a portion of money that says, okay, of the people that are in your cost pool, you had this many qualifying activities, this gives you this amount of money, and then we get to determine how we allocate it. And currently, home visiting is not MAC billing at all, or not in the survey pool at all, but adding them in, we can put a portion of the additional MAC
So
revenue.
Medicaid would just bill or pay.
Right, so this MAC is like administrative claiming, which is, since we're adding a component of nurses overseeing billable work of a CHW, then we have this ability of an administrative layer that's added that we can add in with the MAC surveying. We already bill Medicaid for all of our home visits through the targeted case management. Just for doing the visit, but MAC would be
Yeah.
additional.
Thank you.
Yeah.
all right. That was the last one.
Nice job, guys.
So, I mean, we're here because obviously the project we're putting forth has a general fund impact. Might not be much or possibly any right away, but would be down the road.
So you're really looking for a
Very clear.
3-year commitment.
Yes, and as we would come to the point of requesting ability to hire additional FTE, want to be very clear what impacts could be tied to that as we would do so.
But none of this gets triggered until you got the guarantee from the grant that you applied for.
I would not bring forth the FTE until we had approval from OHA. And the other piece I will say is, I mean, this is our goal. There are other pieces, there's some other expansions. I mean, when some of this started coming out, we were looking at some different ideas and we kind of pared things down based on the dollar amount that we're receiving, because guaranteed 300,000 sounded pretty good compared to what is likely to be a very competitive application process, even though we could have asked for more in doing that. But we also have at some point in the road, universal home visiting is coming to us. I mean, it was passed by the state legislature. It's not been funded great. There's been some struggles with the rollout. OHA is pushing some counties utilizing some of these funds to do those adoptions. And this, if we were able to hire a supervisor position to sit underneath Alicia, we would actually be in position to actually look at that in a way that would be functional and be able to roll forward, that we're just not, we just don't have the bandwidth and capacity to do today.
The one thing about this is there's gonna be a whole lot of counties that can't afford this,
Yes.
and a whole lot of group of counties that can't afford this. So I'm not sure how competitive it's really gonna be, except for the valley. Certain counties will definitely, even though it's rural, but
yes, the every aspect of it needing to be new or expanded limits some of that ability. I'm aware of at least one health department who I believe is just, their answer is, I don't have bandwidth to do anything. I'm not accepting the money, which is not a position they want to be in, but it's kind of reality.
I'm sure there's more than a lot.
Yeah.
Any questions?
Thank you.
And you, at the start, you said that we did budget the first year's expenses in this year's budget.
No, that's why I said it could be as high as about 40,000 based on our projections. That should be the high end number if everything works the way we think, and none of our other discussions bear fruit as far as bringing dollars in.
Do we wait till we find out if we get the grant, or do we go ahead and move forward?
There's no, the requested action in this particular meeting is just discussion.
No, that's why I'm asking.
Oh, I defer to the budget board and Joe on when he wants to time this and bring it before the board for consideration.
I mean, we don't know when we're going to hear. We don't really know what kind of feedback we're going to get directly. I mean, I would feel better bringing it once I had something from OHA that they had blessed
Our budget
our budget that we gave to them, right? You know, for those dollars.
Question. Oh, perfect.
Yeah.
And then I think when we bring it to the board, it'll be to ask for the creation of those two positions to then be able to start recruiting for them.
So the cost is home visits, does that include walk-ins or drive-ins?
Oh,
Just making that-
oh, actually. And I will say, kind of a plug for NFP. I mean, it is home visits and we meet them in their home if that's what they want. But we actually meet them wherever they want to meet.
Some clients prefer to come to our office, some want to meet in a neutral location.
Is that a privacy thing? Is that why they do that?
I mean, some people are worried
I agree.
and have had trauma with CPS coming into their home, and so that doesn't feel like a safe place to be. Some of it could be privacy, right? Like it could be a teen that's still living at home with their parents, and you know they want to be able to have a lot of times we'll meet with teens at the school as a place that they're already going and they can meet privately. We have clients that really don't want a county vehicle sitting outside of their house because that could raise questions in their community or make other people in their neighborhood nervous, and so they prefer to come to us. So it's just, we just meet
That
people
would be
wherever they're
true
at.
in their head. I have a hard time wrapping my head.
We just meet people
I know.
wherever they want to go. Honestly, we're like, oh darn, you want to meet at our office? I mean, like, we're trying to make it easier for you by going to you, and they want to come to us, that's fine. We'll do it wherever they want to meet.
Thank you guys very much.
I
Other
do
questions?
have a question.
Okay.
If you find out that you're getting this funding, is that turnaround time gonna be pretty quick? How
So,
does that?
I mean, yes, but also OHA is slow on all of this. If we get their funds, if our project approves and we get the funds, they are backdated in use to April 1st for this particular program.
They want to get it out there pretty quick.
Yes, yeah. So we will actually be able to backdate funds to April 1st.
We've already started tracking my time on working on this project just so that we have things that we can start claiming on it if recruitment for the other positions takes time.
That's
We
all.
want to make sure that we draw. What was that?
Would that fall under administration then?
So, no, thank you. We would have to, discuss where we want the positions, I mean, or the classification of land. Yeah, and then also, have meetings with the union to establish.
And those pieces we would do before bringing it to the board also. Yes. And then I think there'll also be, I don't know if it'll be timed at the same time as that, and likely it wouldn't, but there would, if we move forward with applying for the incentive funding that can pay 1/3 of the increased caseload seeing of clients, that requires the 3-year commitment piece too. And I think that would be something that would be brought to the board as well in order, as part of that application.
After the 3 years of funding. I haven't been here, so
Sure.
are they coded in their own fund? Like if that stops, the incentive funding, then does the load go completely on the general fund at that point?
So,
If the county
so
wants to continue with it.
it would be general fund minus the revenues, billable revenues, et cetera, that are coming in, right? I mean, obviously the goal is to have the revenues cover as much as we can. It never has fully covered, and I'm not, I'm not super imaginative that tomorrow it will magically start doing so, unless something else has changed or modified.
And one of the, like, when Joe had the table up that showed how much general fund was asked for versus how much was actually spent, there was one year where we didn't have to pay match because it got approved through the legislature that NFP specifically could build TCM without having to pay the 41% match back. And that is still being pursued, and I think we'll be going to the long session this next cycle. Those are other things that will help with sustaining the program beyond those 3 years. But if it ever reaches that point where it's not sustainable to keep putting general fund towards that program, then that's where you can start cutting it back if you wanted. But we do the best we can to seek out all revenue sources that we can to come in as low as possible.
And this type of a program is a priority program, right?
It is for us.
It
It's
is
not a
for us.
required
I mean,
program.
it's not, right? And not all counties offer NFP specifically, but it is kind of the gold standard that's out there, right? I mean, when you look at other home visiting programs, they all want to do what NFP does. It takes a lot of work and it takes a little bit of money to do that, but the outcomes are undeniable.
Thanks, you guys.
Thank you.
Very much.
Thank you.
Any other items? Okay, the rest of us can stick around. We'll start in about 5 minutes for a staff meeting.
All favor?
Yeah. We're moving to the conference.
Yep.
Thank you.